Administration stuff. There's the recording. So without further ado, I would love to welcome our two guest speakers today. One of them you should be familiar with. If you're not, shame on you. Our talk is Wildfire Smoke and Extreme Heat Action Plans. This is very appropriate for individuals that live in BC and across Canada. Our two guest speakers are Dr. Emily Brigham and Jacqueline Turvey. I will let Alexis start the introductions if you want to, Lex.
Thanks, Lindsay. All right, so first I'd love to introduce our guest speaker, Dr. Emily Brigham. She is now an associate professor of respirology at UBC, a practicing respirologist at Vancouver General Hospital and the Centre for Lung Health in Vancouver, and a research scientist at Vancouver Coastal Health Research Institute affiliated with the Lung or Legacy for Airway Health. Dr. Brigham's work focuses on identifying factors that contribute to susceptibility or vulnerability to air pollution and wildfire smoke, testing interventions, and to reduce health impacts and caring for persons living with lung disease. So very, very important work.
Yes, and we love her work.
We love her work. We love having her.
This other face should be familiar to you. It's Jacqueline Turvey. She's been around for a few years and she's award-winning. Most recently, she received the BC Society of Respiratory Therapists Award for community care, excellence in community care. You've seen her talks before, most notably and most recently, she did the Harmonicas for Health and Happiness talk with her colleague, Tracy Gallant. So she should be familiar to most of you. I could go on for hours and I might just.
We don't have time for that.
Let me just, she's done a lot of work, so I want to acknowledge it because it is important. She's provided presentations on respiratory health, topics locally, provincially, and nationally and internationally for many organizations, including Thompson Rivers University, where I am, BC Lung Foundation, Health Canada, the College of Physicians, the Global Access to Spirometry Project, or GASP, right? And she is one of the two respiratory therapists that brought the Harmonicas for Health and Happiness program to British Columbia. She is a huge champion for it. If you have not seen the presentation, it is on our YouTube channel as well. And without further ado, and no more talking, I'm going to hand the floor over to my two colleagues. Thank you very much.
Thank you, Alexa and Lindsay. That was lovely. Let me see if I can get this presentation to share as smoothly as we did before we started, which is always a challenge. All right. Hopefully everybody can see the screen and just the screen. The
Looks great, Emily.
Lovely. All right. Thanks, everybody. I'm just going to adjust something on my end. Okay, perfect. So today we're going to talk a bit about wildfire smoke and extreme heat in the province of British Columbia, what it is, why we have it, how often we're seeing it, and why it's important. And then taking a real, truly strengths-based approach to help to prepare you for the season and think about ways to make sure that you are optimizing your health and your preparation for this. So you heard my name in my introduction. I'm so privileged to be here and have had the chance to work with Jacqueline on this as well. So she's going to start us off with a land acknowledgement, and then I'll proceed with mine.
Great. Thank you so much, Emily. It is with humility and a commitment to reconciliation that we gather on traditional territories of various First Nations. We acknowledge their stewardship over these lands and express gratitude for the opportunity to contribute to the health of all who call these lands home. I'm currently on the traditional and unceded territory of the Secwepemc Nation, specifically Tecumseh to Secwepemc.
Wonderful. And I will acknowledge I'm an immigrant from the Piscataway Nation on the east coast of the United States. Came here about 4 years ago and am currently living and working on the traditional unceded territory of the Musqueam, Squamish, and Tsleil-Waututh Nations with utmost gratitude. So we'll proceed, and hopefully I can get this to advance. See, I knew. There we go. Okay, so just an overview of what we're looking to talk about today. So we'll, for those of you that have heard this talk before, some of this may be a review, but we're going to chat about climate change and health think about populations who may be at enhanced risk and need to take additional steps for protection, and then really talk through some of the exposures that we should be familiar with and understand and be alert to. Then we'll go through action planning. So how to prepare in advance, how to think about these things and make sure that when we are in a smoky environment, when we are dealing with extreme heat, which are the two exposures we'll talk about today, that you feel ready. You feel like you know what to do, and you feel like you've got access to resources. So starting a bit about climate change and health. So this is a slide with some pictures from the National Institute of Environmental Health Sciences in the United States, really looking at not only the changes in climate that we expect to see, but then the downstream effects. So if you focus on the table in red, climate change is really driven by an overall average increase in global temperatures over time. But with this, we see a lot of variability in temperature. So sometimes it's really, really cold and we're getting these cold snaps and colder than we've experienced and expected. But then sometimes we are getting these extreme heat events moving through. We're seeing extremes in precipitation, which we felt very viscerally in the British Columbia region. Sea levels we expect to rise with melting of ice caps and so forth. And then we're seeing changes in seasons and changes in growing seasons. And all of these things really result in more frequent episodes of what we would call extreme heat, changes in our food sources, our air, our quality of air, changes in pollution levels, changes in some of the infections that we see over time, and then allergens, particularly important to those of us who have allergies and underlying respiratory disease. We are seeing that allergy seasons are becoming more severe and lasting longer. So we're having to prepare for that and helping to prepare our patients for that on the clinical side of things. And today we're going to focus really on extreme heat and air pollution more specifically, as well as the downstream health impacts of these changes. So with extreme heat, we know that individuals with underlying respiratory disease, such as those as COPD, may feel these more acutely and may be more at risk from some health effects resulting from these, with changes in air pollution as well. And this can contribute to, certainly, I'll just mention exacerbations of respiratory disease as well. So I'm going to transition to Jacqueline to start to get into some more specifics of what we see.
Great, thanks, Emily. A lot of what we know about wildfire smoke and the health effects are short term. It's hard to study as it's unpredictable when it's going to happen, and it can't be averaged over long periods of times. It's hard to come up with models to look at long-term health effects. But those kind of things are under development by different groups, and Dr. Emily is involved in this work as well. Everyone knows that you can have respiratory effects from wildfire smoke, like cough, wheeze, phlegm, difficulty breathing, infectious and non-infectious bronchitis, decreased lung function, increased flare-ups of asthma or COPD, or otherwise known as exacerbations. Then there's increased hospital utilization or ER visits as well. And you can see we have a question mark by lung cancer, as there are very few studies that have been done. Currently, there is one study done that suggests thermal exposure may increase cancer risks. Wildfire smoke contains pollutants like polycyclic aromatic hydrocarbons, benzene, formaldehyde, phenols, heavy metals, all of which are known to be carcinogenic or cancer-causing. Exposure to these pollutants through wildfire smoke may increase the risk of developing lung cancer and other cancers, particularly in those individuals living near the wildfires. There are effects on the heart as well, including heart attacks, heart failure, increased hospital and ER utilization as well. With wildfire smoke or any kind of air pollution, it can be harder to think. People's abilities to do tasks are reduced. People can have headaches, strokes, and people who experience long amounts of smoky days, long periods of time, or those who have close ties to land can experience decreased mental health as well. At the bottom, we see question by preterm birth, and there's some emerging data that wildfire smoke can contribute to preterm birth as well. Next slide, please. Okay. There are groups that are at higher risk to the effects of wildfire smoke, and those include older adults, 65 years old and older, infants and children 5 years and younger, pregnant women, people living with chronic lung and or heart disease. And there are those that fall into a couple of these groups, and they can have higher risk than those in just one group alone. Next slide.
So this is a map from a satellite looking at a component of wildfire smoke called black carbon. And that's really the product of combustion of burning material. And so darker areas mean higher density of this burning material, or this smoke in the air, and lighter areas mean less concentrations. And this is from 2021. When smoke from about 300 wildfires in British Columbia were drifting across into the United States. You can also see some fires down here closer to California and Oregon, and a little bit in Washington State drifting across. And this is really to make the point, one, that this is happening, which we all know, we're all living in this area too, but also that smoke travels thousands of miles. And so when this occurs, it's not just the individuals that are closest to the fire that need to be paying attention to what's in the air, but it's really individuals everywhere that are downstream from this smoke. And this is a recent study that has come out by one of my colleagues, actually in the office over, who does a lot of work looking at data in British Columbia. She's also affiliated with the BC CDC. And you'll recognize the map of British Columbia here, and we'll start on the left-hand side. So what you see is a map looking at the number of days between 2010 and 2022 where different regions in BC experienced extreme heat, with darker colors indicating regions that historically have been more impacted. And then down below in the blue, the same sort of a representation of number of days over this cumulative time period that were impacted by wildfire smoke. As you move to the graph to the right, that's sort of like shades of magenta and orange and purple and so forth. These are the number of days where both were occurring. There was co-occurrence of these events. So where individuals were affected by both wildfire smoke and extreme heat. So this emphasizes, again, with many regions experiencing multiple days where these things co-occurred, we really have to think about these things together. And that makes a lot of sense when we think about how these occur seasonally during summer months, although sometimes creeping into the fall as well in the springtime, but that this is something we as British Columbians will need to face and need to think about. Just to the right of this, you can see there's all the years are listed from 2010 on the bottom up to 2022. And on what you see is sort of the what's called a distribution, or the number of days that during a specific year were impacted by both smoke and heat. And what I want you to notice is down at the bottom, that distribution is kind of all the way to the left. And then as you move closer and closer to 2022, it's moving further and further to the right, which means more days being impacted. So we're seeing this trend where this is becoming more frequent across British Columbia. So we have to give tools to prepare.
Thanks, Emily. Let's talk about the health effects of extreme heat. We've discussed smoke, and we must also discuss extreme heat and the health effects that come from it. Have a look and see, you can see the signs of heat exhaustion up there on the slide. I'll just name a few: skin rash, heavy sweating, feeling dizzy. With longer exposures or exposures to higher temperatures, it can move from signs of heat exhaustion to more emergent and serious condition, heat stroke. And so you can see some of the signs of heat stroke there: higher body temperature, drowsy or fainting, confused, less coordinated, very hot, or red skin. It's important to try and catch this situation earlier with the earlier signs. And in 2021, as Emily was talking about, much BC experienced a heat dome. It was 27 days from June 18th to July 14th, and it was associated with 740 deaths in our province. In fact, the heat at that point, a new record was set by Lytton at 49.6 degrees Celsius. That is hot. And while we haven't had this exact situation since, we have had periods of extended heat every summer since. Next slide, please. So when we speak about smoke and heat, our at-risk population list expands. So those with other chronic diseases, including diabetes, kidney disease, or other. Those with physical or mental disabilities, including dementia, they have less ability to react quickly and to their environment. Those with mental illness for the same reason. Those with social isolation, those that are living alone, they may not have anyone to help them. Those that have jobs that require outdoor work. Those with poor quality housing or no housing. And those that are taking certain types of medication that may reduce their body's ability to cool itself, like those including beta blockers, or medications that increase body temperature, those that are taking antipsychotics. But just a little note, a little side note, never stop taking medications without speaking to your primary care provider. Another at-risk group are those who use substances, including alcohol. Again, they may have reduced response times. Next slide. And so we're going to talk about knowing your exposures next. Next slide. I told Emily as we were working on this project, this might be one of my favorite pictures that I get to speak to in different talks. Wildfire smoke is complex. There's a whole bunch of chemicals, gases and compounds, carbon dioxide, carbon monoxide, nitrogen oxides, volatile organic compounds, and other agents that are released. One of the main components of air pollution we track is called particulate matter, or PM. Particulate matter is made up of particles, little bits of solids or liquids of varying sizes floating in the air. The ones we focus on the most are PM 2.5 and PM 10. Size is important in terms of health effects when it comes to PM. How we name PM is dependent on the size, as said. PM 10 is anything less than 10 microns in diameter. Have a look at the slide. This is shown in blue. It's the blue dots, and includes things like dust, pollen, and mold. And it's about a fifth size of human hair. You can see 5 of those dots, those PM10s, on that strand of hair. That's kind of that golden brown. PM 2.5, which is shown with the red dots, is about a quarter of the size of the PM10 molecule and below. It includes things like combustion particles, so smoke, organic compounds, metals. This size is most related to health effects. There are very small molecules that are about a 25th the size of the PM2 and below, and these are called nanoparticles. We can't measure these like we measure the other kinds of PM. PM10 and PM2.5 are monitored by government agencies, and these can be seen in reports that are put out with weather reports, especially PM2.5. Just note, and next slide is going to talk to it, the smaller the size, the more deeply they can penetrate into your lungs. Next slide, please. I also like this slide because it shows where these PM are depositing and where they can travel into the lungs. So particulate matter, PM10, tends to deposit in the upper airway. So you can see that kind of the nose, the back of the throat. The PM 2.5 to 10 tend to deposit in the upper airway. Those that are 2.5, those that are 0.1 to 2.5 go deeper down into the airways, and PM that are less than 0.1 travel to the small airways and alveoli. The nanoparticles can actually go all the way into the lungs, alveoli, and transfer into the bloodstream. These molecules can actually activate our immune system and cause inflammation and oxidative stress on our body. These are processes that are already going on in those clients with COPD. Next slide, please.
I think this is me. Thanks, Jacqueline. And I just want to comment on that. I share Jacqueline's enthusiasm for that slide and thinking about the size of particles and so forth. And we actually Jacqueline and I use that, and pharmaceutical companies use that same properties when they're making inhalers. So the smaller the particle size, the deeper it gets into the lungs. So they measure their distribution of particle size and think about that when they're creating medications for folks with asthma and COPD. But I want to talk to you a bit about the Air Quality Health Index. So this is the way that Canada reports air quality. So some of you may have seen something called the AQI, which sometimes pops up in different regions. That is the US system. Sometimes it's still calculated based on Canadian air pollutants, but it's got a very different scale, and it is not linked directly, or not not created surrounding health effects. So you want to really anchor on the AQHI, which is what we use, which is the representations we're going to talk about. So the AQHI is calculated based on the relative risks. So the amount of risk, basically, of a combination of air pollutants known to harm human health. And the three that are included are three that Jackie already mentioned. This includes ozone at ground level, fine particulate matter, or PM2.5, and nitrogen dioxide. Both ozone and nitrogen dioxide are gases, whereas particulate matter, PM2.5, are those particles. And those particles, the PM2.5, can be really high in wildfire smoke and is very strongly linked to health. So much so that when they, and this is some background information too, but when they calculate the AQHI during wildfire season, they weight the PM2.5 really heavily in that calculation. So you'll also see later on when we're talking about specific recommendations that we'll give, and that BCCDC gives, not only the AQHI, but they'll also report PM2.5 levels as well. The AQHI is on a level of 1 to 10 plus. Lower levels, 1, 2, 3, are in the blue zone and are considered sort of lower risk. And then as you move up closer to that sort of maroon color, you're getting to be higher and higher risk. And we'll go through specific health recommendations for each of those. And this really captures only the short-term or acute health risks. So important, going back to what Jacqueline was speaking about, we're still trying to figure out some of the longer-term risks of wildfire smoke and doing a lot of research surrounding this. But we'll be talking about short-term risks within this. And then importantly too, right, smoke can change pretty quickly in an environment. So we'll actually recommend checking a few times a day. You can't always see the smoke that's there. So it's important just to know where to look for this. But there's forecasts. There are forecasts available to help you to plan activities and so forth. And we can make sure that Lindsay and Alexa have those lists in the after this. Also important, so that's air quality. That doesn't incorporate temperature, but BC also puts out information on temperature and then has heat alerts and heat emergencies. Heat can be tricky because our body adjusts to heat to some degree, and some people are better at adjusting than others based on what underlying conditions they may have, what medications they're taking, and so forth. But in recognition of this, BC and really all across Canada takes into account, when they're giving heat warnings, what average temperatures are, typically in different regions. So you'll see that the threshold at which heat alerts are put out and heat emergencies are declared actually differs by region. And that's based on what we know of health effects. Alerts and warnings come out through what's called the BC Provincial Heat Alert and Response System, or BC-HARS. And this is showing some of the 2018 thresholds from Environment and Climate Change Canada. And that's really just to emphasize this fact that it differs by region. All right, so we're going to get into what do we do, right? How do we understand what is going on in our environment? How do we check in? And then what are the next steps to take? So, and we'll go through this in an action planning approach. Important to know, action plans are, of course, tools that can really outline some specific actions to take under different conditions. And we have an expert here with Jacqueline Turvey as our one of our educators in the province too, who's going to walk us through some of the foundation of action plans, which hopefully a lot of you are familiar with already.
Great, thanks, Emily. This slide shows an example of a COPD flare-up plan. Some of you may have actually been using this one, and many of you have worked together with your RT, respiratory educator, or other healthcare professional to create it. I use action plans with almost all of my clients that have COPD or my clients that have asthma. I think they're such a valuable tool. Action plans are extremely important to help my respiratory clients with self-management of the respiratory disease. It allows the client to be proactive. We're not in an emergent situation. We have a plan in place if something pops up. And an action plan serves as a detailed roadmap for achieving specific goals by outlining necessary steps or resources and timelines that we need to do things. The action plan provides a structured approach to achieving a goal, like preventing a flare-up or reversing a flare-up, ensuring that individuals and their team, because remember, this is built by the client as the captain and then the team as the support people, their health team. It helps us all stay organized and focused and accountable to what the plan is as well. Individuals with asthma, COPD, or even other chronic respiratory diseases have a higher risk to poor outcomes when it comes to exposure to wildfire smoke. And Emily is going to lead us through the next slides to discuss a new tool. Some of you may have heard about it already, to help folks with self-management during wildfire and extreme heat.
Thanks, Jacqueline. I won't advance to the next slide just yet, but I just want to reflect on the story of how this came to be, which was BC is a place where a lot of people are working together to improve the health of folks with underlying lung disease and the health with multiple individuals and chronic conditions in the face of these climate health threats. So I was invited very early on when I came here to be part of a workshop that was geared towards working with family practice doctors and providing information about how to prepare patients for wildfire season in advance. And I came as the respirologist and I said, make sure that your patients have their asthma action plans if they have asthma, their COPD action plans if they have COPD, so that they know how to react if they're triggered by the wildfire smoke. And Christy Newton, who's one of the family doc leads in BC, said, well, gosh, wouldn't it be great if we had a wildfire smoke action plan? And I think a light bulb went off for a lot of us. We absolutely, as we're talking about all these different things we're advising for patients, wouldn't it be great if they had more of a checklist and a how-to? And also a way to educate providers on how to counsel their patients. And so I had just started at the University of British Columbia and was starting to figure out where I was going to land and so forth, and had some time and the support of something called the Legacy for Airway Health, which is a large endowment that was given by a grateful patient to UBC Hospital Foundation that has provided some support for projects like this. And some people to work on it. And so we just put pen to paper and started coming up with how would we take these amazing action plans that already exist for patients with COPD and asthma and translate that to the steps for patients who are experiencing wildfire smoke and need to be prepared, which is really everybody is experiencing this. So this was one of our very first drafts. We came up with the BC Wildfire Action Plan. And when I say we, it's truly a we. There's so many of us. I get to speak on behalf of this, Jacqueline being one of them, but it's a very large we. And we got some initial feedback from some folks who work with Legacy for Airway Health, are patients living with respiratory disease and form part of what's called a community stakeholder or community partner committee. And those individuals are listed here to the right. And one of the first pieces of feedback we received was, why aren't you talking about extreme heat too? We said, aha, you're absolutely right. We need to do that at the same time. We can't separate these things are occurring together, and patients have to know what happens when these things do occur together. So that has evolved over time after working with our patient partners. Then we brought it to Jacqueline and some of the respiratory therapists and respiratory educators in Vancouver Coastal Health, and worked through and did a whole bunch of updates on this, and then started working through a quality improvement process in interior health with folks there, as well as in Vancouver Coastal Health, and have now shared this more widely. It's publicly available, and we're constantly looking to update it. But what it has become, and we're always taking feedback and making adjustments, is really a two-sided sheet that is intended to, once filled out with a respiratory educator and or your GP, to post in a place where it is readily accessible, so that you just have a plan for what to do when it gets really smoky, and have a plan for what to do if it gets really hot or if both occur, and that you're as prepared as you can be in advance of that. So we really focused on things like, I know my air quality and temperature. How do we check these things? What's the way that I should be getting the most valid information? 2, my home and supplies are as ready as they can be, right? What have I done and what have I thought about in advance so that I'm as prepared as I can be during these events? And then thinking about if my home environment isn't up to where I need it to be and I'm still having symptoms, where can I go? How do I do this? Who do I call? I have this sort of next steps in place. And then on the other side of it, it really is sort of understanding what your own personalized health recommendations are for different levels of temperature and different levels of air quality, which we'll walk through as well. Now, physicians are still figuring this out too. There is a lot of information out there. There's a lot of really great information. I think BC has taken a huge lead in this, not only nationally, but internationally. So it's pretty amazing that we have all these resources available, but it's a lot. And there's a lot of physicians that are already also working very hard, respiratory educators very hard. You know, there's a lot of information that you're getting on the patient side. So how do we make sure all this is filtering through to those who are helping to walk you through? And so we created all together a provider guide that sort of providers can keep next to them in the setting of when they're going through this form with the patient. So that if you've got questions and that provider doesn't know the answer just from memory, they may have some resources that they can look to and they can help to get that answered for you in real time. So I'm going to keep going. I'm on a bit of a roll right now. But so one of the things we'll talk about is how to check your air quality and your temperature. And how often should you be doing this? So province of BC realizes and recognizes that different people may want to check this in different ways. And so they put this information out through a number of venues. And so we'll try to go through piece by piece. And what I may start to talk about is air quality first. And so this is a copy of what's on the first part of the action plan. And the first thing is we want to make sure that everybody's receiving emergency alerts when they are put out. So by phone, most phones are what we call LTE enabled. Almost all phones are now, such that if a heat emergency is declared, you should be receiving that on your phone. Now, a heat emergency is very specific. It is something where not only has the temperature reached the levels where we're in extreme heat, but the temperature is expected to continue to rise. So the lack of receiving a message saying there's a heat emergency doesn't mean we're not dealing with heat problems. And so we really encourage folks to be proactive and to check, because this again, heat alerts are only, those heat emergency warnings are only put out in very specific scenarios. And the lack of receiving a warning like that doesn't mean that we're not dealing with high levels of heat that could be dangerous from a medical perspective. There's also ways to receive alerts through an air quality subscription service. And there's a QR code on the right-hand side for those who have smartphones, but we've also got the links, and all these links will be available after this as well, where you can actually sign up to receive alerts for your region when there is a high level of smoke that's occurring. Again, we still recommend you to be proactive and to check, but this can be a way, again, another kind of reminder that comes automatically if you're checking your email frequently. Really important. If you see smoke or smell smoke, it's high risk. I mean, no doubt. But just because you don't see or smell smoke doesn't mean there's not higher levels of particulate matter in the air or that the air quality is good. So we really recommend checking during wildfire season particularly, but also, you know, we can see higher levels of smoke actually in the wintertime too, due to people using wood burning stoves and so forth like that. So it's good to get in the practice of just checking more frequently to really understand best practice for your day.
Emily, if I could just add something here.
Okay.
I know that there had been some alerts out too in the springtime when we get the wind and the dust that's been left as well. And you can have higher air quality health index numbers with that as well.
That's super important. Thank you, Jacqueline, for emphasizing that. Yeah, totally agree. So how do you check these things? How do you check in frequently? Well, you can check on, for those who have a smartphone or those who are comfortable using the internet, there's a Hello Weather or WeatherCan app that will report the air quality health index and also show any heat alerts. You can check online, I mentioned. So BC Air Quality Reports for Smoke. There's also BC Weather Alerts, and some of those links are also to the right-hand side. Radio, if you identify, for some folks who just either don't want to use those things, can't use those things, are worried that those systems are going to go down, having a radio channel that you know and trust where they report the weather is important, and you can write that down in advance. I will also note, so hopefully you can see where my cursor is, that this hello weather in this white box up here. So this is amazing. This is very proactive thinking by the province. So this is a phone line that you can call and receive weather reports, smoke reports, and so forth for your specific region. So there's a code that you have to look up online in order to do this. If you Google hello weather, you'll see all the different regions and you can click down and find out what your code is. So you call this number and then you type in the code and it will just give you reports of that too. So another backup for folks. And then ideally, right, there are going to be some of you who may not want to be the ones checking all this, looking through all these sources, may not want to circle one and do that, or just may prefer that you get this through a secondary source. So who can you call? Right. So thinking ahead about folks you can contact, family members, somebody you might live with, a really close friend who's keeping up on this and who will be your buddy to call for this kind of a thing. But how do you put those systems in place in advance? And I just want to also show, so this is what one of the bulletins will look like if you sign up for the email bulletins, and Jacqueline was mentioning those too. You'll also get weather alerts that come through for other sorts of weather events, but this is a Smoky Skies bulletin, and one that I received because I've signed up for them all over the province of BC, just out of curiosity to know what's going on. Our Smoky Skies bulletins and so forth, we are as good as our monitors are, right? So we detect based on what air quality information that we have. The Air Quality Health Index is calculated based on the federal monitors, and those are limited. We know that some folks in rural areas, it can be many kilometers, even 100 kilometers away from a monitor. And smoke really varies in space and time. So that can mean that you can be getting smoky regions and AQHI from somewhere that's actually pretty far away from you, and your levels could be higher or lower. So important to pay attention, but also to look outside and pay attention to that. But there's another source of information too. So for those who like to go and play online and so forth too, I want to highlight this. It's a very simple website, AQMap, or very simple letters to get into this website. The website has a number of layers in it, but I enjoy looking at this too. It's called aqmap.ca. And what it shows, this is a map of Canada where you can zoom in. It shows all the different kinds of monitors that are present across Canada, and you can zoom into BC, specific regions, and so forth. And this includes not only federal monitors, which are in the diamonds. If you go down on the bottom right-hand corner, you'll see different monitor types, but also low-cost sensors that people have individually posted. And this is maintained by the University of Northern British Columbia. It's color-coded based on PM 2.5, which those color regions sort of equate to the AQHI when PM 2.5 is the major pollutant that's within it. And you can also, you can see my cursor, Jacqueline, anybody can see my cursor? Yeah, hopefully, okay. If you go up here, there's actually, you can look at different layers and so forth and play around with which monitors you're looking at, which monitors you aren't looking at. The important part about this is that our low cost, right, the federal monitors are highly regulated. Those are accurate measurements. We're getting the ground truth of what we see in terms of PM 2.5. These low-cost sensors are actually pretty good until you get to really high levels, but they've gone the extra step of using mathematical equations to do what we call calibrate them, such that they've now tested these against federal monitors, and they've applied these equations such that these are more accurate measures even in some of the low-cost sensor monitors. So it's worth just going in and looking through this site. There's a lot of information there. And for those of you that really want to dive into some of the intricacies of air quality monitoring or may live in more rural areas, it's worth taking a look at this too. All right, Jacqueline, I'll hand off anything else
Perfect.
you want to add, or also hand off.
I just want to add around the purple air. I noticed that was one of the monitoring systems that out of curiosity, I did a little search in my area, and I know there's a number of individuals who have purchased that actual device and are using it in my community. And, we can see what those numbers are coming out of their home and where that location as well. So looking at this slide, this portion of the action plan is ideally filled in with a clinician or physician who knows you and what your individual risks are, and can work with you regarding how you can react to smoke in regards to your past behaviors. So health messages for your activity at different levels or varying levels of the Air Quality Health Index. On the left, you can see the BC Air Quality Health Index from 1 to 10 plus, as well as the 1 hour averages of PM 2.5 for others that may have access to other air quality monitoring systems, as we mentioned, or Emily mentioned just recently. During smoky conditions, a reminder, PM 2.5 is one of the most important things that we're going to be monitoring. Next slide. So how we fill this in is based on public health messaging. For individuals that are at higher risk for whatever reason, the activity recommendations can be slightly different than for those that fall under the recommendations for the general population. So let's have a look at the moderate level. So those folks who are at higher risk need to consider reducing or rescheduling strenuous activities outdoors if they're experiencing any symptoms. While general population really have no need to modify their usual outdoor activities unless they're experiencing symptoms. But we want to point out that the most important thing to remember is if you're experiencing symptoms, then you need to act. So if that means seeking cleaner air, then do that. Next slide, thank you. So this area of the action plan gives tips for extreme heat. The extreme heat alerts that come through, as Emily was talking about, are based on the temperatures outside. The dangers we see most are related to the indoor environments and specific to certain temperatures, because those thresholds from the outdoor air and the outdoor thresholds are not on this resource. The indoor air temperatures are the thresholds that we're going to see on this resource. So the outdoor temperatures are what's reported through our systems, but what we need to look as individuals is what are our indoor temperatures, because those have the most effects for our health. We can do this, we can monitor those temperatures with a digital thermometer for our home and for our own personal use and temperature as well. You see at the bottom of this slide here, the area for tips for cooling your body and also tips for how to cool your home as well. And again, if you're having signs or symptoms of heat effects, even at lower temperatures than what are shown here, seek help or medical attention, because everyone's an individual and our bodies can react differently. Next slide.
So I mean, such an important point that how the province issues these alerts are based on outdoor temperatures, but really the indoor temperatures that we see, where we see the most health effects and so forth. So super important. And so we'll talk about how to really optimize your indoor environment in preparation for these changes. So this is the second part of the action plan. This is really thinking steps ahead and making sure that you have as many of these things as you can have in place to really optimize the place that you're living. Recognizing no one individual may be able to do all of these, but the more things that you can do, the more prepared that you are, and then just having a plan for when and if you need to relocate. So assuming you're able to, well, we'll talk about, I'm going to jump over the first two check boxes because those are very important to think about and have in place. If outdoor conditions are poor, but you've optimized your indoor conditions, how do you then avoid leaving to go outdoors? So think about in advance delivery systems for food, making sure you have enough food, extra medications, and so forth. But one, having a home thermometer, extra batteries is needed to monitor your indoor temperatures and really think about some of those things and when to enact some cooling processes above and beyond just your own individual symptoms, but having a sense there. Thinking about window coverings to block the sun and the heat during the hottest parts of the day to keep your indoor environment cool. Some individuals have a heat pump as a part of their home or are able to install one. There are some BC rebate programs and so forth. But also thinking about an air conditioning unit and or a fan, ways to sort of cool the indoor environment. Very important with a fan, if you get to hotter temperatures in the home above 35 degrees Celsius, doesn't actually cool things down. It just moves the hot air around. So a fan is only helpful as long as your indoor environment is already sort of cooling down, but fans can be very helpful too. And then thinking about an air cleaner. So we're going to talk a bit more about air cleaners. The key portion of that is that you want an air cleaner with a HEPA filter. HEPA is called high efficiency particles. So it filters out the high efficiency it takes out the PM 2.5 is what I'm trying to say. It's most effective at reducing that, which is the pollutant that we're focusing a lot on because it's so closely tied to health effects. And it's also really high in air pollution, in wildfire smoke as well. And then important to know too, one of the things we think about in optimizing the indoor environment is During wildfire smoke events, we think about sort of preventing the outside air, which has a lot of smoke in it, from coming inside, and then recirculating the air through a HEPA filter to reduce the amount of particulates in a certain area. Also trying to stay away from doing any activities that actually increase indoor particulates, anything that's burning related. So cooking on an open stove, candles, try to avoid like really heavy sweeping, which just kicks up a lot of dust. But again, anything that has a burning component. But that doesn't always work so well if you're also in a heat event. So if your temperature is rising inside, and yes, your air pollution is going down, what should I do? And so it's actually recommended that most are known that most people are more susceptible to the acute effects of extreme heat than necessarily the wildfire smoke itself. And so if you're in a position where you're having to decide between opening your windows or closing your windows and it's getting really hot inside, it's recommended to actually open your windows, get that cooler air in, and then try to get to a place where it's cooler. But we don't want you inside in a really hot environment. That can actually be more dangerous. Thinking about if you have to relocate, having available a supply of well-fitting masks. So ideally, and Jacqueline's going to talk about this more, but an N95 or KN95 that's well-fitting is really the best at filtering out some of those particles. But we'll also talk about other masks. And then as we're thinking about really indoor temperature and we're thinking about lowering pollutant levels indoors, oftentimes it can be easiest to do that and sort of put resources into a single room. Because of the air filtration effectiveness, it can be hard to clean out a whole house, but if you've got a single room that's kind of closed off and cool, that can be your safe space. And it's oftentimes recommended that that's the place where you spend the most time. So it often ends up being a bedroom too. Thinking about if you have forced air heating, so if you have outside air that's coming in through vents and so forth, talking to your service provider, whoever is your company that helps to provide you that heat, about how you can sort of optimize reducing having particulates coming in, filters and so forth like that. And if you are working outside the home, knowing that you're in a more susceptible group, talking to your employer in advance about how you can stay in a cleaner and cooler airspace as well can be really important. There's a couple of QR codes on here that link to the BC CDC resources, a number of patient-facing sheets as well that can be really helpful. And those are also available through BC Lung too. But zeroing in on some of these, so a lot of questions always come through about how do I actually pick an air cleaner? How do I know which one is right for me? And so the most important things to focus on are that you have that HEPA, that high efficiency particulate air filter, HEPA, as a part of whatever air filter you choose. That it's rated to your space, meaning that it actually cleans. I mentioned like going into a smaller room. The smaller your space, the more easily you're going to be able to filter out those particles and keep them filtered out. But when you're choosing a filter for a room, or when you're choosing a purifier for a room, you want to pay attention to what's called the clean air delivery rate. They should provide like how many square feet this is good for maximum efficiency. And that's the width times the length of your room too. So if you're in a 10 by 10 room, this 167 should meet your qualifications here if they had this kind of a label. And then lastly too, so if you'll remember, ozone is a part of our air quality health index. Higher levels of ozone are known to impact air quality and have health effects. Those air cleaners that have an electrostatic precipitator and do not have an electrostatic precipitator can actually produce ozone. So we really recommend that you just stick with the standard ones that have HEPA filters in them and available, and stay away from electrostatic precipitators, likely for now. They will help to clean the air, but they can produce some ozone, which may be important for folks who are more susceptible. And lastly, air purifiers can be expensive. We know this, but there's ways to make them yourselves. And this is a fantastic program called the SFU Breathe Project that's also partly sponsored by BC Lung, led by Dr. Anne-Marie Nicole. And it walks you through, this is a link down below, we'll provide more links to this as well, but the steps to actually create an air cleaner at home using a box fan and an air filter. So just the MERV 13 air filters that you can purchase that you might put on your home vents, you can use them here. And it's really important to know too that there's actually a way that you can sign up to have community events where they will teach and walk people through how to create these as well. So we'll provide the links for that, and the links for that are on BC Lung too. But there's a number of resources available through the BC Lung website on how to make your own much cheaper, and they are effective in reducing PM 2.5.
Emily, I just love the idea of this project. I think it's amazing and such a great resource for people. And I'm hoping to connect with you guys and figure out how to bring it to my own community. And this project reminds me of a little anecdote that I have. A couple of years ago during wildfire season, I had a neighbor next door say, "Come on over and look what my son built me." And their son had built them a similar type of air cleaner, a DIY air cleaner. Their son was also very techy and built them a particle counter. And so the particle count was very high before they turned on their DIY air cleaner. And then after running it for a day, it was down to normal levels. Now, I don't have any sourcing for a particle counter. I don't know how to build one either, but I just thought how amazing that was that they were able to take some things from home, just like this project, and create a safer environment for themselves.
Love that. Science in action. We can't fail to mention that there's some potential cost coverage for this, for both air conditioners and air filters, cleaners, or purifiers. So this is, I just want to highlight here, that's on the CRA website. And so for individuals who have a chronic ailment, disease, or disorder, severe chronic ailment, disease, or disorder, air conditioners can receive some funding. And the same is true for air filters, cleaners, or air purifiers for those with a severe chronic respiratory ailment. These both require a prescription. And Jacqueline has looked up so that as per the CRA, just to keep this in mind too, the threshold for eligible tax deductible medical expenses is about close to $2,500 or 3% of your net income, whichever is less. All those are back calculations to figure all this out and so forth. But I think the key here is to make sure that if you have a severe chronic respiratory disease, if you have severe COPD, ask your doctor for a prescription for this and then count it, try to put it into your taxes, right? We should be getting you funding for this.
Mm-hmm, absolutely.
I lost my clicker. Hold on a second. So sorry. There we go. Okay.
No worries. And so we just want to talk about a program from BC Hydro that offers free portable air conditioners. It's available to people who received a recommendation letter from the Regional Health Authority's home care program. That is very important. It is the only letter that someone can use to apply for this program. This is the only document that's accepted. Other documents, such as letters from your family doctor or other medical documents, are not acceptable when applying for this program. So when you're doing the CRA stuff, yes, get your physician letter prescription. Through BC Hydro, it's different. It's the Regional Health Authority's home care program. The offer includes one portable AC unit. The units are on wheels. They're installed by connecting a flexible duct hose through an open window. And there is, on their website, there's a eligibility criteria and explains how to get that. And so you do have to be eligible and meet the criteria for that. But if you do meet it, then the BC Hydro will install it through one of their contractors. Those folks that already have an acting AC unit are not eligible for this, just to let you know. Next slide. And so Emily did talk about masks or respirators, and these can be helpful for some folks who need to go out in the smoke or who experience smoke within their own environment. And while the recommendation is to use an N95, these are certified in Canada or US and are more for medical use, or an KN95, these are certified through China and are used more commercially. These are not always available or they're expensive. And just for you to know that when we're talking about the N, that means not resistant to oil. And when we're talking about the N90, or we're talking about 95, it means the mask is efficient at removing, 95 efficient at removing microns 3.3 in size. But it actually is even more efficient, even higher efficiency with particles that are smaller or bigger than that. Now, when we're talking about the masks, I've got a couple here and hopefully you can see them. You see that okay? This is a mask that we would use in the hospital. And there's a certain way to put it on. We do teaching and we do testing to make sure that the mask is the right fit. This is one shape. There's multiple. And these aren't always available for people out in the community and public. So this one is a KN95, the other one we talked about. And you can see these elastics, instead of going all the way around, these ones would fit over the ears. So I'm going to put it over my nose, and then I would hook it over my ears. The most important thing when we're talking about these kind of masks is the size or the shape, that it's fitting the face as tightly as possible. And so if you found one that fits, fairly well, as you're shaping it, because there is a metal bar around the nose, we don't want to pinch it because that creates gaps. And so when you put it on, you're going to put it on. Okay. And then you're going to use both hands to form it around your nose, just like this. I'm going to check to make sure it's not folded. And then I have a well-fitting mask. The other thing we want to point out is sometimes those things aren't available. And some sources, including the BC CDC, suggest that surgical masks may provide some protection if it's well fitted to the face. Obviously not as good as the N95 or the KN95. And again, as we said, these surgical type masks, they just need to be well fitted. Again, you'd want to shape them with both hands around your face. Next slide. So at the end of all this, the important thing to remember is to have a plan. If you can't optimize your space, what are you going to do? Where are you going to go? And what if the smoke is so heavy or there's a fire near you and you have to go outside? What are you going to have? Well, you want to have your mask, your pre-packed to go bag with water, snacks, medications, and essentials. Also important to have a safe transport option in place. So again, all this is being proactive, right? So you're not trying to deal with a super stressful situation in an acute phase, right? You've already got a plan in place. So if you're not able to maintain safe conditions inside your home, where are different places that you can go? The term clean air shelters is something to use for some of these spaces that might be safe for you. And you may hear this term. So examples of indoor spaces might include somewhere where family and friends are, their home, community centers, libraries, malls, other public spaces likely to have cool or clean air. And you want to ask about common spaces in any rental units. So like laundry rooms, rec rooms, or gardens. And we want to encourage people to inquire with their building managers to learn whether these spaces can be used and shared as cool or clean air spaces. We also want to suggest it's really important to have a buddy or someone you can check in with a couple times a day, just so that you have someone that's keeping an eye on you, or maybe you are that buddy for someone else.
Thank you, Jacqueline. So we wanted to post some of the major resources here. So on the left-hand side, we have, we've been showing excerpts of the plan, but this is all posted online, all of that information. We will post updates as it's available and as we receive more feedback. We have two versions of the plan. One is more of a pamphlet, but all with the same information. One's that page back and front. And then we have both a provider guide and a community organization guide that will get you so far and then direct you as to when, direct community organization so far and then direct us to when to refer to a medical doctor or a respiratory educator for further information. I just want to add on to what I love watching Jacqueline do the mask fitting and so forth. I know that she's been certified in that. To mention to really reinforce the idea that a mask should not be wearing a mask overnight too. So it isn't necessarily like a rescue. Oh, I have a lot of high pollution in my home, but I'll just wear a mask overnight and I should be fine. Would not recommend that. You need to get to some cleaner air too. And also the masks for those, patients who are living with lung disease, you end up being some of the most informed about your environment and about heat and so forth. And I suspect you may get some questions from family members about, how do I do this? How do I deal with this and so forth? which I hope is empowering in order to be able to purvey this information. We appreciate it absolutely. But knowing that masks don't always fit as well for kids too. So thinking about young kids and their ability to withstand a mask and needing to get to cleaner air sooner. The two other links here are for some, through BC Lung, there are links to information on wildfire smoke, some of which go directly to the BC CDC, and for heat. And then down at the bottom, I've put the email for Anne Nicole Marie, who runs the Breathe program, which is the DIY air cleaner program. She's happy to hear from folks about like wanting to do a program locally and have like a building session and everything else. And then there's also links if you go through the BC Lung wildfire smoke to how to send in a requisition for that as well. But she was very kind and like, yes, please spread the word about this. We want to get more people air cleaners. So that contact is there as well.
I think that's great. Thank you so much, ladies. I know we used the full hour for the talk. I feel as though there was such relevant information that a lot of questions weren't actually generated and put into the chat box. Kelly did make a point, which was so interesting because she put it in during the presentation, and that I feel like you perhaps answered the question. It was just noted that the AQHI is a good indicator. However, in those rural our areas, there may only be one weather station or one source of information, as you highlighted. So recognizing that different resources will have different information for you. So I think that was really great. I feel like it answered the comment. Barry asked about, is there an email to get the chart that you showed with the blue triangle showing the conditions over the province? It was further back in the PowerPoint. And Barry, you can turn on your mic if you want, just to clarify. Was it the slide with the 3 versions of the province, or was it the one with the dots and the triangles that showed the country?
Sounds like the acmap.ca.
Okay. Yeah, I feel like it was perhaps this one, because he said blue triangles, yes. So just the aqmap.ca. aqmap.ca. I will just put that, there you go. So that's where you will get that map. Perfect, thanks, Kelly. And then the links were included at the end of the presentation for everybody. So if that helps out, perfect. If there are other pieces of information that you're looking for, please don't hesitate to either go through the Better Breathers Facebook page, and Alexa and I can source the information from Emily and Jacqueline and then forward it on to you. All right, I'll give just a couple more minutes. We're over our time and I know everybody is busy, but are there any pressing questions that might be present before we say thank you very much to these 2 lovely, very smart women?
I have a question for you.
Yes, what's your name?
I'm Steph and I'm in Courtney.
Okay.
And I would like to know where you get those forms for filling out the care programs.
Oh, for getting an air conditioner?
No, for the personal care.
Oh, the action plan.
Yeah.
So that was at the end of the presentation, the last slide, but
I don't
Jacqueline
have a cell phone, so.
Oh, okay.
Steph, do you have a respiratory therapist in your area that you connect with?
No, I have asthma.
Okay.
But I have it very well controlled. So I just have a GP.
Perfect. It looks like Emily put it in the chat box for you.
Okay.
And the link is there.
Oh, that's far too long for me to write down.
Can you click on it?
It's not there anymore.
Oh, in the chat box?
Oh,
I don't know how to do that.
It popped up as a notification, I bet, and then disappeared from your screen. I can do it again and see if it works, but I also wonder if we could get you.
I can also email it to you. Steph, do you have an email address?
Yes.
Can you put, oh, yeah, go for it.
STEPHJN7@gmail.com.
Gmail.com. So that was STEPHJ as in Jack, N as in never, 7 at gmail.com.
Yes.
.com. Okay, I will send that information out to you right away, so you've got that available
Thank you.
too. You're very welcome.
Because that's a good idea, and I have none of that stuff.
It's a great idea.
We used to have a Better Breathers group here, but it came apart with COVID.
There is a Facebook group for Better Breathers if you're looking for that kind of support again, which I would highly recommend. Alexa is part of it as well. And
Okay,
I have
why don't
just
you
sent
send me
you.
that contact
Yes.
too? I do the
Oh.
Better Breathers exercises twice a week.
Okay.
But that's the only contact I have now.
Yeah, that's okay. We'll get it to you.
Great, thanks.
You're very welcome. Anyone else before we say thank you so much, and we'll see you next month.
It sounds great.
It is great.